Well, hello everyone, and welcome to the Enrichment Center. This is Del Barnes, Director for the Enrichment Centers here in Hernando County. It is an honor, it is a great opportunity and a privilege for me to be here. And if you're looking at the screen, the way that I'm looking at it, I'm between two wonderful ladies, and you know, I don't get the opportunity for that too often. So I am. It is a delight on my on my screen left, right. Either we have Erin Thomas over at the Emergency Operations Center, and on my right, I have Nina Mattei from the Health Department. And listen, it's a wonderful thing when people can come together in the community, for the community, to help the community, to look out for the community and all those who reside in that particular community. Here in Hernando County, I have discovered that there are so many people who love to help others. And there's a thing called the village mentality. Years ago, I remember when I was a little boy and my mom and dad would cook a meal. Um, and I would wonder why is that pot so big? Why are they cooking so much when it's just a little bit of, you know, and the family is so small? And I would discover that after a while that my dad or mom would say, Del, here, take this over to the neighbor's house, and I want you to give this to them and just let them know to enjoy. That it's in some cases we still have that, and in other cases it seems like we have lost a little bit of that village mentality. It takes a village, you know. And I am discovering that there is still that element still reside here in Hernando County. And it is so wonderful that we can interact with each other, look out for each other, share information together and with each other, and that's what it's all about. That's what it's all about. Nina, there's a song that I'm trying to remember, um, and I can't remember. It said, "Make the world go round." Y'all, people make the world. That's why I got to stick to saxophone playing. Uh, People make the world go round, you know. So, so the reason why we're here today is we just wanted to have a conversation, and that conversation, we've been hearing so much about COVID-19. We've been hearing so much about, you know, making sure that you wash your hands, making sure that you distance yourself and you stay away from other people, not in the literal sense because the person is no good, but because you want to stay healthy and you want the other person to remain healthy as well. And COVID-19 has just come in. One, it has blazed the trail throughout many nations, many countries, many states and cities, and it seems like it is still continuing. So we have a specialist. I call her the specialist. That is Nina Mattei, and she is on today with us, and she has some answers to some questions that you as a senior. Now this we want you're watching this and you are a senior, you are 65 and over, you're 55 and over. We're not trying to say that you're not going to make it. We're not trying to say that it is doomsday. We're trying to say that together we're going to make it through this.
Right.
And that's the whole gist of conversation. So I'm going to turn it over to Nina. This way she can let us know where we're at with regards to statistical data. And Nina, you ready?
I am. I'm ready.
All right, do your thing, honey.
All right, brother. So, I think it's particularly important right now. You know, we're in the middle of the holidays. We're almost to the end of the year. The first few days of this week were cold and wintry.
Mm-hmm.
You have relatives in other parts of the country. You know that they are hunkered down. Blizzard's coming, and I kind of think of it as the sort of the cold and dark days of winter. And we've got the holidays that come around and add light and warmth and family and friends and fun and food. And that's wonderful. And then we move ourselves into the new year with the hope of a bright and better spring. And I really think that those are the things right now that are in my mind is saying it was cold early in the week, but I know it's going to get warm. The cases are spiking up right now for COVID, but I know that we're going to get a hold of that. And the best news of all is that it looks like we have many um, useful vaccines that are going to come onto the market.
Mm-hmm.
I really see those dark days of winter moving us into that little glimmer of hope with new growth and renewed vitality for spring. And I say all of that to say we're in a tough spot right now. We really are. Florida, but really the Midwest of the nation. We get lots of data here at the health department. And a couple of weeks ago, half of all of the people who tested for COVID in the Dakotas, half of them, if there was 100 who tested in a day, 50 of them came back positive. They're having enormous spikes. And so it's a tough time. New York suffered all of that in April and May, and we had that in June and July, and now the whole rest of the country has it. And so I think we just have to keep faith that our medical community is strong. The supplies and the equipment, we're not having those shortages that we had, but all of us have to just keep doing the right thing, even though we hate every single minute of it.
Yeah.
Yeah. I don't know. That's what I'm thinking about today.
Well, Erin, what's happening on your side of the house with regards to, keeping in mind with regards to the focus of the enrichment center is on our seniors, 55 and over, those who may be in their home or those who may be in an ALF. What's happening from on your side when it comes to that?
Yeah, a good bit actually. So I really like what Nina had to say about it's just such an uplifting, positive message to think about. We're looking forward to improvements in the way of vaccine, and we know that some people want it, some people don't. Obviously, that's a personal choice, but isn't it just so great that we can have the technology and the resources to be able to develop something like that? It's a blessing. From the long-term care facility perspective, we continue to keep a close eye on those partners to make sure that they have enough supplies in the way of personal protective equipment, as far as gowns and gloves and masks. We know that the state is getting ready to make another push of those items directly to our facilities. So sometime over the next several days, our local facilities will be in receipt of some additional items, which is great. We know that a lot of things are coming back online as far as availability in the commercial market, but certainly never hurts to have a little extra. So we're grateful for those resources that are coming. Most of our facilities are doing well from a staffing perspective, so we haven't had any of those concerns in a while, and know that everybody is looking forward to what is to come over the next several weeks. As far as our senior friends, I know it's particularly difficult, particularly around the holidays. We we want to get together with our kids and our grandkids and hug and kiss and all those fun things. And it's exceptionally difficult to have to make those kinds of choices for the greater good. I similarly, heartbroken over it, but definitely interested in preserving public health and safety to the extent that we possibly can, and doing all of the things that we've been talking about. Sometimes Nina and I were talking the other day, like, gosh, sometimes it feels like a bit of a broken record. Wash your hands, stay home if you can, wear your mask. And sometimes that message gets a little redundant, but all of it bears repeating. And even though it's hard and we're having to make those difficult decisions, we're doing it not, I do it to not just keep myself safe, but I do it to keep Dell safe. I do it to keep Nina safe. I do it to keep my little man safe. So there's that.
Cool. So Nina, let's look at some numbers. How are we doing here in Hernando County?
Yeah, so let me know. Can you see my screen now?
I see a blank screen. There you go. Got it.
Got it. So what we have here, Dell, is it's all of our cases for the last 2 weeks, right? All the people who have tested positive. And if you see this, this bar chart here, see where this yellow is right there? That's all the number of new cases in Florida, right? Mm-hmm. And then up here is the distribution by age. And so if we go over here and we select, let me move that out of the way. All right, so we go over here and we select our Hernando County. And what it shows is we've tested so far since the beginning of all of this, 5,140 people in our county have tested positive. They've had COVID. Almost 600 people have been in and out of the hospital, and very unfortunately, the number of people who have passed away is now over 200 for Hernando County. And so we look at this dashboard here at the health department all the time. We look at it every day. We're comparing the numbers, and what it helps us to do is it helps us to see over time what's going on. Intuitively, we know how busy we are, but it sometimes helps to see that, yeah, wow, it was just back in mid-November when we had a little bit of a dip, and then look at that, it popped right back up. So we're very curious right now to see what the impact of Thanksgiving was. Yeah. But this is a good snapshot if you just want to look and see what this looks like. And anybody can look at this data. You can type in COVID dashboard or Florida Department of Health COVID dashboard, or FDOH, like Florida Department of Health. Any of those things will get you to a link for the dashboard, and then it pops up and you can look at the state, you can look at any county in the state. And so that's very useful. The other one that I like a lot, which is part of the dashboard, is down here at the bottom. And if we look at these health metrics, I'm going to click on that. And somebody told me metrics is just a fancy word for measurement. And so if we look at these health measures, this yellow one, you see the yellow one, Dell?
Yes, ma'am.
So way back over here, in the middle of October, that week we tested 151 people came up positive for COVID. And we're doing like about 100 tests a day. So it's out of 500 people or something, just here at the health department. There's other people in the county testing. The next week, the county tested 204. So it was 50 more people than the previous week. The next week, the middle of, or the beginning of November, it sort of steadied. Middle of November, it was steady. And then look here, 364 or 346 people tested positive. So that's like a third more.
Yeah.
And then we're still increasing here, 369 for the week ending on the 22nd. So it's important for people to know that the number of cases is increasing. And you could say, well, of course you're finding more cases if you're doing more testing. We might test 140 people here in a day. I think our largest was 170 for several days, 150. Yeah, you're going to find more people who test positive, but this is the one that really matters down here. You see this red one, Dell?
Yes.
It's our positivity rate. And we want
It's
something
going up.
below 5% because 5% tells us that the amount of illness in the community, the disease burden, how much it's impacting us. The lower it is, of course, the better. Under 5% is kind of our benchmark. And so way back at the middle of October, we were under 5. The end of October, we creeped up. November, creeped up again. Middle of, next week in November, creeped up again. And now we're up here at 8 and 9%. And so, sure, we're testing more people, but ideally we want this to remain down here. We want the positivity rate to be a straight line or a line that goes down like that. This line is going in the wrong direction, really honestly. That's all there is to it. There's way more people who are positive who get tested, which tells us there's probably way more people in the community that we never test that are getting infected.
Now,
So,
let me,
yeah.
if you don't mind me jumping in with a question real quick.
Yes.
Looking at that target range, and we're close to 10, we're right on that 10% dotted line.
Yeah.
Now, is that all Hernando County residents?
So it's the percentage of, if let's say we did 1,000 tests in a week, we would want 50 of them to come back. No, what would we want? 10% is 100 of them. Yeah, we would want 50 of them to come back. That's 5%, right? But we've got 100 of them coming back. We've got twice as many coming back then, and that tells us that the disease is continuing to spread. That makes sense?
Okay.
It's the number of positives out of the bigger number of total people we tested. And so that's how we know that we've got a higher burden of disease, is because the percentage of people coming back with a positive test is going up, and that's in the wrong direction. Does that make sense?
Yeah.
So
months ago, Hernando County was extremely low.
Right.
Numbers wise.
2, 3, 4%. Yeah.
And this is alarming to know that we are on that line now.
Right. Absolutely. It's very alarming. And so we take that very seriously, because what we know is that more people are being exposed. And so it goes right back to what you were saying, Dell, about washing our hands, and what Erin was saying about avoiding crowds and stuff. We don't want to do that right now. We want to celebrate the holidays. We want to have fun. We want to get together on the weekend. And really, those are all risky activities. But it's hard to do the right thing when you really just want to connect with people, because that really feeds all of us, right?
That's like taking the cake that I like to eat, that I love to eat, taking it away for a little while.
Yep.
And you can't have it.
Right.
And then you give me a piece and another piece, and now you're telling me I can't have the cake again.
Right.
Right. And
well, it's even worse than that, right? I'm not even taking it away. I just lock it in a plexiglass container, and you still see it on the counter. You just can't get to it.
Oh, that's just mean.
Oh.
Right? It's even worse. You want to connect with your peeps, and we're saying don't do it. And you're saying, but it's right there.
Man.
Yeah.
So okay, still looking at this 10%. I don't know if there's a way to look into that and see how many are the high risk, those who've been tested, how many are in that high risk category that have been tested?
Oh, I gotcha. Okay.
Isn't that is that the cases by county tab, Nina?
It might, yeah, it
Or it
might,
shows the demographics?
yeah, let's see. Thank you, ma'am.
Yeah.
So, yeah, let's see. Let me move this other thing out of my way. Um, let's see. So here we have it by race,
Uh-huh.
and we have it by ethnicity, um, and then we have it by, thanks, Erin. We've got it by age distribution, right? And so what we know, Dell, is we know that people over 55 or 65 are at an added risk for bad outcomes. And people who have other health issues already going on, they're at a worse percentage for bad outcomes as well. And so our cases have been pretty much in this hump shaped or bell shape here.
Right.
They're skewed a little bit more to the younger folks when kids went back to school, but we've got, you know, a good amount of folks here in this age range, which is really the danger range. We've got a good number of
Yeah.
people.
Okay, so
Where does
my
it show that that county report that you like so much? I think it shows the ages of the hospitalized folks.
Yeah,
over
here we
time?
go. Can you see that?
yeah,
Yeah.
is there a way to
Yeah.
make that a little bigger?
Yep. How's that?
Yeah, baby.
Let me drive this car. Okay. So these are all the folks being tested, right?
Uh-huh.
And all the folks going to hospital. And let me scroll out for just a second, Dell. Let me get to the page. Here we go. I need to get to page 55. Bear with me. Here we go. All right. I was like, why does it say 1 million cases? We don't have 1 million cases in Hernando.
Nah.
I got all
That's
scared for
terrifying.
Oh, that, yeah.
Okay. So this is Hernando County. And let me go right up here. This is our number of cases. This is the number that have came up
5,170.
positive, right? And
Uh-huh.
these are their age ranges. Half of the people who test come up below the age of 50, half are over the age of 50 or 54. It varies by week, but it gives us an idea of who's sick and where. So let me scroll down, and I know that's it's a little hard to always look at something like that. So of our new cases, the week ending just 2 days ago,
Mm-hmm.
see that people in the middle age category, more of them popped up positive last week than anybody else.
Wow.
Good number of kids, not an enormous number of older residents.
Well, that's kind of good.
Yeah, but here's the gig. Look at this one. Who ends up in the hospital, right?
Right.
So if we count up 9 and 6 is 15 and 5 is 20 and 21, a third of the people, right, that came up as cases last week were over the age of 55, right?
Mm-hmm.
But look at how many more people in that same age range were in the hospital, right? And remember, people stay in the hospital for quite a many number of days, a couple of weeks. And so this is sort of people who are newly in the hospital and people who have been in the hospital. But look at how almost nobody who's younger, right, ends up going to the hospital. But if you're 55 and older, right here,
Right. That's where it
you get
begins.
sick, you know. And then very unfortunately, of course, it really, really, really has had a horrible impact on folks who are older and being such a deadly disease. So this may scare people, and I don't want to scare them, but what I want people to see is like, oh my gosh, this is a risk for me. And if I can do all those things to keep myself healthy and safe, I need to do all those things, even if it means not eating my wonderful slice of cake.
Oh.
together, somebody's got to be the adult, and it's Erin.
Guys, that, guys are making me hungry.
I know, right? I want some cake. I'm going to bust into Dell's plexiglass cake box.
Yeah, but think of it. Think of exactly what you just said, Erin, right? We're making you hungry,
Yeah.
right? It seems like that's where we are right now with people wanting to get out.
Yep.
You know,
Yes.
people
Same.
wanting to have that exchange. People,
Mm-hmm.
you know, we receive phone calls. Are you guys open? Well, you know, we are afraid to come back because, you know, we're not sure. The numbers are going up, and we've heard where, oh, this is a political thing. Oh, you don't need your mask, and things of that nature. So there's so much stuff that's out there, and some people are now wondering, who do I believe? What do I believe? You know, so many are in a quandary what to do right now, you know? So as a county,
There's a lot of misinformation out there.
right, and that's why I wanted you guys to come on, so that, you know, we can really dive into this a little bit, and to help to steer our folks, especially our seniors, you know, because many of them have questions, you know. So I'm sorry, Nina.
No, that's wonderful. You guys are exactly right. I mean, it seems so obvious to people in public health. We've got a mess on our hands. We really do, with these cases rising. And so it seems to us that the things that we know that work is washing your hands and staying away from people. And you say, well, how do you know that? Well, here's what we know about this virus. The coronavirus is covered in a lipid, and a lipid is a fat. You know, like when you go get your cholesterol checked and it tells you about your triglycerides and your lipids and all that, right? Well, a lipid is a fat, and this virus has a coat of fat on it. That's exactly why washing your hands works, because the soap and the friction busts open that fat covering, and then that kills the cell. So that's why we want people to wash their hands and scrub with soap and water, because the soap is what's going to dissolve the fat around the cell, and the scrubbing is what's going to bust it apart. Now, hand sanitizer does it too, and the scrubbing part is important, right? There you go. Yeah. And so Dell's like, I need to clean up here a little bit. But it's pure science, because that's what we know about this cell, and that's how we know we can kill it and get it off of stuff, right? And then we know that it's airborne. It's in what we breathe in and out, right? And we know that those droplets can stay in the air for a little while. So is a mask 100%? No, but if you're walking through something, it's going to catch, you know, a good amount of it. So we know that it works. And I think that that's what's discouraging is that you didn't send your kid to school when they were sick, right? You didn't go to school when you were sick. Let's stay home when we're sick, kind of a thing. You know, it feels very self-evident. These are the ways that we keep ourselves safe and other people. But we also want to be able to do the things we want to do. And so it really is I think it's a moral struggle. I really do. I think it's an ethical or moral struggle that every single one of us goes through every day. And we want to think that we have our best interests at heart, but sometimes we just want to go out and have a good time. And it's hard to say that, you know, don't go out and have a good time. But on the other hand, it's easy to say, stay home.
Modify.
Yeah, Wi-Fi.
So
I have a question for you, Del, if you don't mind. Put you on the spot.
Okay.
So you mentioned, and I think we've had this conversation a couple of times, that, you know, your members are feeling, unsafe maybe about coming to the center, even though there's lots of mitigation measures that you've implemented. I was wondering if you have any, are there commonalities in the questions that you might be getting? Is there anything that you can share with Nina and I from thinking more about, like from a public education perspective? Is there something that people are particularly concerned about or want to know about that we can do more to address?
I believe that one of the main question is the insurity, now on a national level, no one is sure, no one knows exactly how long this will last. One of the things that a lot of the seniors were concerned about was the information. You know what I mean? And I think you said it not too long ago, just a couple minutes ago. It's the misinformation. Knowing who to trust, the credibility of the one giving the information. And some people just don't. Some people think too that right now, okay, the numbers are going up now. There was a school of thought that it was political. You know what I'm saying? So many of them right now are being safe to the point where they're refusing to go anywhere. So, in answer to the question, it was the mistrust of information. Did that answer the question?
It does. It just, I was hoping for something that I could, do something about.
Well, I mean, in terms of, and it's hard, Erin, because even though just the other day, I had someone come in to clean the center, right? And we cleaned it, we sanitized it, because now, we did it at the beginning, we did it again, but still, we don't have people coming in by the droves, they're just cautious. So if we can tell every business, clean, sanitize, folks are still refusing to enter locations because they want to be safe. I wish I could say, okay, put my finger on this and say, this is what we need to adjust. This is what we need. It's kind of hard.
I guess then I'll take the compliment that you feel like we are trustworthy sources of information. So you'll have us with you.
Yes. Yes. And
I hear a lot of people ask me, when is this going to be over? And I just, bust out my magic 8-ball. Ask again later. See, not even the magic 8-ball does.
See, I mean, I remember I don't even remember the movie, but there were movies that you would watch, and someone would have that, like you said, the 8-ball, the crystal ball, and they're looking and look at it and say, blah, 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 and then you see this thing, when you couldn't see it, but now you see it, it appears, and that's what's going to happen. We don't know, So again, is that in being insecure when it comes to going places, trusting places, that's the big problem, So let me throw this out there. The vaccine. We have a lot of talk now with regards to the vaccine. What's the situation with that? Let's talk about that a little bit.
Sure. Yeah. So the vaccine has been, the process for developing vaccine, it's a very rigid, very, very regimented process. It's a very careful process. And that process, all the steps are in place for these vaccines, but they've been sped up, and it's nicknamed Project Warp Speed. It doesn't mean that they've cut corners, and it doesn't mean that they haven't done all the things they normally do. It just means that they've done them very rapidly. And so I was talking to somebody the other day, and they said, how do I know the vaccine is going to be safe? And I said, well, each of these vaccines has gone through like 3 phases of trials with 10 or 15 or 20 or 30 or 45,000 people in each trial for each vaccine. So there's a lot of people who have already been exposed to the vaccine, number one. You can't get approval without us, the federal government, understanding how the vaccine affects people and how effective it is, right? So that's part of it. Is there's a process, it's just been sped up, but all the steps are in place. And so that's, I think, important to understand. There's several vaccine candidates. The one that's going to come out first is from Pfizer, and then another one from a company called Moderna. There's a couple more right behind there. I don't know their names. And those are all 2-dose vaccines. You get a vaccine today and you come back in 3 or 4 weeks and you get another one, and then you're fully protected. The one from Johnson & Johnson is a single dose. So we like that one the best. But it's a little bit further back in the running for getting approved. But the good news is that the Pfizer and Moderna are going to come out pretty quickly here. And so then you say, well, that's wonderful, but think about, how do you make 1 million or 2 million or 50 million doses of a vaccine? Everything takes a bit of time. So it's going to come out in waves and phases. And so you have to figure out, if we're only going to get 30 million vaccines in the first phase, who do we want to vaccinate first? Do we open it up to anybody and everybody? Or do we come up with a fair process, and one that really is going to beat back this disease? And so there's an advisory committee, and they've come up with, it's folks who are healthcare workers, especially healthcare workers in risky environments, working in the hospitals and stuff. And then also folks who are 65 and older. Because remember, if we go back to our bell curve here, right, those are the folks who are really at risk. And then folks who have other health and medical conditions that would make them, if they did get sick, their outcome would be much more poor. And then first responders, and what we call critical infrastructure, people who just keep our society running. And so those are some of the priority groups. But woven in all of that is something about your job, something about your risk factors, and then something about equity. And it's really important to talk about equity, because what we don't want to do is we don't want to miss a group of people, or we don't want to focus in one area and exclude other people. We want to make sure that everybody has an equal chance to get vaccinated. But if you're 20 years old and you're healthy, you're not going to get vaccinated for many months, right? But if you're 65 and you have diabetes, well, you've got a couple of risk factors there, and we would hope that you get vaccinated sooner, because the chances of you getting sick and having a bad outcome are way, way more than a 20-something-year-old person, right? So it is that horrible word. It is rationing a scarce resource, but it's not just done off the cuff. It's done with a lot of thought and a lot of consideration, because everybody can't have it all at once.
Wow. Now let me throw this question out with regards to with the ration. Okay. I know that, okay, would folks who were tested positive, okay, would they, let's say, be on a list of priority, or whether which it doesn't matter your age?
Yeah. I haven't heard anything. It could be a subgroup. I haven't heard. That's a great question. I haven't heard anything about folks who are
a great question.
Positive. Yeah, it's a great question. But I can follow up for you.
Okay.
Yeah. because we don't know how much of a protective factor you have if you've been exposed and sick or not.
Right.
So,
Yeah. So Erin, thinking of the vaccine, and again, it was a great meeting this morning. And the question is now, let's say Hernando County receives X amount of vaccines, right? What would we be looking at as a county?
It's an interesting question, and I think I have to point back to Nina because the Department of Health is taking the lead on the planning for the distribution effort. But I will tell you that we coordinate closely. I think everybody pretty much knows that Nina and I talk just about every day, sometimes multiple times a day, and about all kinds of things, and more recently, particularly about vaccines. And it's interesting. Personally, I will share what, I watch the news, you all watch the news, we're all trying to keep an eye on things. And personally for me, I feel like there's a bit of a misrepresentation that, that there's going to be all this vaccine for the masses, and everybody's going to be able to get it whenever they want it. And based on what we're hearing so far, it's just not going to work out that way. There's a very small percentage that's only because you can only make so much in such a brief period of time, right? So hence the reason for that prioritization that we were talking about. But I think it's going to be interesting because we know eventually there will be enough readily available that we could open something. There's a concept called points of dispensing, and we partner with the Department of Health to manage that process, and they work closely with community partners. So eventually, someday, I wish I knew when, but someday we'll have enough vaccine to, get that concept up and running, and it'll be, widely publicly available. In the meantime, it's going to be a very strategic process as far as working with DOH and all of our other key partners to make sure that we're doing our best to equitably distribute based on the small amount that we are going to receive over the next couple of months. Did I mess that up too bad? Sorry, I don't mean to speak on your behalf.
No. And I'm glad Dell is recording it because I'm going to use that again and again and again. You said it very well, friend. So, where did I want to start with that? Let's go back for a second to your question, Dell, if you've already been sick with COVID. So I Googled up, and the CDC website says people who have gotten sick with COVID may still benefit from getting vaccinated due to the severe health risks associated with COVID and the fact that reinfection is possible. May be advised to get a vaccination, even if they have been sick with COVID before. So yeah, no holds barred, come and get your vaccination. Absolutely.
Wow.
Yep. The other part of it is that, Governor DeSantis said, I think 2 or 3 days ago, he said that Florida is probably going to get 1 million or 2 million doses of vaccine to start out with. And you go, my gosh, that's an enormous number of vaccines, right? Well, we've got about 18 million people in the state. And so, ironically, Hernando County equals almost 1% of the state's population. We've got about 188,000 people in our county. And I say this because it makes my math really, really easy. So if we're going to get 1 million doses of vaccine, we're going to get, for the state, we're going to get 18,000 here in Hernando County in the first wave. But when you start kind of looking at, well, how many people are 65 and over? How many people are on dialysis? How many people have diabetes? How many people are on cancer treatment, et cetera, right? How many people are on medicine for cholesterol or heart disease or have had a stroke, et cetera, right? And that 18,000 is allotted very, very quickly, right? We've got 48,000 people in our county over the age of 65.
Wow.
Yeah, so right there, we know that's a big group of people, right? We know that we've got about 1,000 or 1,500 first responders. you know, they're going to be up in one of those first couple of risk groups, not the very, very first ones. We know we've got several thousand healthcare workers, but not all of them work in the hospital. So we're working with all those partners, like Erin said, to say to the hospital, how many people work there? How many people are in a high risk job? And how many of those people want to be vaccinated? And so those are some of the numbers, right? Because not everybody who fits the category cares to be vaccinated.
Mm.
So those are some of the math problems that we're doing, right?
Right.
And what we don't want to do is we don't want to waste vaccine once we have it. And we don't want to drag our feet. We want to get it out there as quick as possible. So that's like what Erin was saying. We talk a lot every day. The problem is that the process is moving so quickly that the information changes every day, you know? But once we start vaccinating, you know, then it's going to be a very steady process, because once that production ramps up, once those 3 or 4 or 5 or 6 companies are making vaccine, we are going to get steady shipments of vaccine. But the very first part of it is we're not going to have a lot, and we're not going to have enough for everybody who fits those categories.
Right.
So a little bit of patience is what we're going to have to really, really, I think, keep in mind.
Wow.
Does that make sense? Yeah.
Erin,
And I know that was a lot to spit right out there. So if you have a question about it,
you do it well. You do it well.
thank you.
Erin, you were going to say something right before, if you remember. I thought you were going to say something right when Nina was about to answer.
Sorry.
I frequently talk over Nina, so I apologize.
Perfect.
All right. So Nina, why wouldn't a person want to be vaccinated?
Sure. Yeah, that's a great question.
You know?
So I've had lots and lots of discussions with people in the last several weeks about being vaccinated and not being vaccinated and what they believe and don't believe. Some people are just very cautious, right? In marketing, there's a term called early adopters. And early adopters are the people who go out and buy the very newest iPhone, or they buy the very newest telephone or television, right? Mm-hmm. They want the newest, brightest, shiniest, whatever it might be, right? And then there's other people that are in the middle that say, I want to see what happens. And, you know, those first ones, I don't know. And then there's other people who say, yeah, when what I have now breaks, I'll get the new one, right? So those early adopters are always very eager, but a lot of people are very cautious, and they say, I'm going to see what happens, you know? And that's why I specifically said earlier of how many people are in the test trials for these vaccines, because by the time someone who is reluctant is in a category where they'll be vaccinated, literally millions of people will have already been vaccinated. So they'll be able to see in real time how effective and how safe the vaccine is. Does that make sense?
Got you.
So if you are a little cautious, nobody can make anyone get vaccinated, you know, like that. And what good does it do us to make people so angry and frustrated? But if you are, you know, cautious, wait a few weeks. You know, we would love for everybody to get vaccinated as soon as possible so they're protected. But the very fact of the matter that we're going to have, you know, not enough vaccine for the number of people, it gives us the opportunity to see what's going to happen. Okay. So see what happens. Keep an open mind. See how safe and effective it is. Some of these are 90 or 95% effective, which is an enormously huge effectiveness percentage for the vaccine. So we're very encouraged with that.
Oh, that's good. But what about side effects?
Sure. Yeah.
I mean, we know that there's some medications that treats this and treat that, but you know, it affects those. Right. You know, it affects that part of the body or yeah. You know, we hear a lot about the 95% effectiveness. Right. But we're not hearing anything about possible side effects.
Yeah. Right? And absolutely, that's a great point. In fact, part of our planning involves once somebody gets vaccinated, asking them to have a seat for 15 minutes, just in case they feel lightheaded or they just don't feel very well. And so you can expect that your arm will be sore. You might feel like you're a little achy and painy. You may feel a little bit worse than that. But by and large, they haven't had dramatic, what we call adverse reactions to the vaccine. But it may be that when you get your second dose, you feel as poorly or maybe a little bit more poorly. So we're not going to downplay that one bit. People might feel a little yucky after being vaccinated. But part of it is your body is fighting against this vaccine so that it makes antibodies so that when the real virus attacks your body, you've got the upper hand. So a little discomfort now to avoid a lot of discomfort possibly later. Yeah.
Okay.
I had another thought about that. Oh, there's another piece of that.
Well, while you think about that, let me tap into Erin. What do you think? And I haven't heard of an executive order or anything of that nature yet, but if there is, what do you think? What is your thought that the process would be if we get one? How would that affect Hernando County, you think?
Well, just in general, so I would refer back to, there's a YouTube video. The Governor DeSantis has been pretty active on television lately, doing some, what seems to be like pre-recorded snippet videos that are, very digestible, a few minutes. And the most recent one, I think, was yesterday or day before yesterday, but specifically talking about that even though the vaccine is going to be readily available eventually, and certainly we encourage everybody to go forth and get vaccinated in the interest of public health and safety, it's important to note that in any circumstance, there's not going to be a mandate that you have to get it. And I think it harkens back to, the principles that are outlined in our Constitution: life, liberty, and the pursuit of happiness, right? All good things. So I get the impression that there's not going to be any kind of a specific mandate that says you will get vaccinated. It's a personal choice. All we can do is help to provide the information so that you can be appropriately informed to make your own decisions based on what you think is best for you, given your individual circumstances and your family and your risk factors. Nina, is that kind of what you're thinking as well?
Absolutely, sure. And the other part of it is that it is a personal decision, and you do have to weigh all of the benefits and the risks. Somebody asked me earlier this week, if I get the vaccine, can it give me COVID? And I said, no, absolutely not. It cannot give you COVID. The way this vaccine is made is that it uses a piece of COVID virus that's been killed. It's actually dead. And they actually attach that little piece of virus onto a piece of RNA. And then that's part of the vaccine. It goes in, you get vaccinated with that, your body recognizes it, fights against it, and then eliminates it. And so it's pretty remarkable achievement. It's called messenger RNA. It's just fascinating. But the point of it is that little scrap of virus that you're being exposed to, it's dead, it's been killed. And so you can't catch COVID from it. And so I think that is important because that takes away one of the fear factors from people. And it makes it a vaccine that's more tolerable to folks also. And so I think that's helpful as well. So you can't actually get COVID by getting the vaccine. Your body's reaction to the vaccine may make you feel sick. And people sometimes who get the flu shot, they say, I got the flu from the flu shot. It's literally impossible because, again, that vaccine is a killed virus. The virus is dead in the vaccine, but it has enough of the DNA markers that your body recognizes it and fights against it. And then when your body sees the real flu, it's got some armor. It's been in that fight before. It knows how to attack, and it knows how to, wipe that virus out. So I think that that's very helpful too to people, that it's impossible to get the vaccine, but you may feel kind of yucky because your body's working overtime to get those antibodies going, and so that can make you fatigued and tired and feel pretty yucky for a day or so.
Okay, so now we put out a lot of information with regards to, the numbers, the vaccine and the good. Let's look at something positive. What can you know what I'm saying,
Yes.
right? I mean, what?
Let's talk about college football. The Heisman Trophy. That's positive.
No, I mean, and we know that COVID is here.
Yeah.
It's a fact. It's here. What can we do? One, to emotionally, physically get through this.
Yeah. Yeah.
So,
Dale, when I popped onto the call and you had just popped on too, right? What did we both talk about? I was eating potato chips from lunch, right?
Yes.
And so it's this overindulgence, this stress and anxiety, this frustration and loneliness, all of this stuff. And people are eating more, they're drinking more, there's couch potatoes, and somehow you got to drag yourself up and out of that, And we both said, yeah, we gained weight and we tried to lose a little and it popped back, and then the holidays are around. And you just got to try to get out of that moment, where you're going to have that cocktail, or you're going to have that potato chip, or you're going to lay around instead of getting up and doing something. We've got to figure out a way to bust through that stuff that's Velcro, it's like Velcro holding us back. So I think that's what's going to see us through also is just taking a deep breath and saying, I'm going to do it differently today than I did it yesterday.
Wow.
Not easy, right?
Yeah, that sounds good. Anything, Erin?
It sounds good, but
it sounds good. You figure out how to pull that off, you let me know.
Oh, let me tell you. Yeah. I can tell you all the best places for French fries in the county.
Oh, heck yeah.
Heck yeah, man.
Heck yeah.
Yeah.
I will say I am exceptionally grateful for the partnership that we have with the Enrichment Center, and it just when I get kind of bummed out, I want to go see my family, I want to go see my friends, and I think about all of the really cool programs that have been adapted and modified because of COVID, which is like a really lousy reason, but it just shows that it's so important, that social engagement, that intellectual interaction, that it's worth it to make the leap, right? So all of the virtual programs that you're doing online are so cool, and I know people are really enjoying them and taking advantage of those. I remember a couple of months ago, I think our friends at United Way started a pandemic pen pal program, and that's been wildly successful. And they sending out little anonymous notes to people in the mail who are, a little more isolated and lonely. So that's been very cool. I think I saw a recipe swap online, thinking about, man, I've been itching to get in the kitchen and do some holiday baking, because that's my jam in December. But yeah, it looks a little bit different this year, right? As much as I wash my hands, I'm not sure everybody's going to want to eat my peanut butter cookies. You know what I'm saying? So all of those adaptations that we make to kind of, maintain some sense of normalcy while keeping each other safe also is just, it's hard, but it's also kind of uplifting in a way.
Wow, that's awesome, and thanks for that. I always think of a team. My philosophy is working together as a team, because as a team we can overcome great things. because at the end of the day, I don't know it all. You don't know it all. But when we come together and put together what each of us know, now we're placing bricks on top of bricks, layer by layer, and the building is coming together because we're working together. I'm thinking of being positive, and I wrote in our recent this month newsletter. I talked about love, and I firmly believe that when we have a love for people, and we have a love for people, we love ourselves, we love people. I would want to wear the mask because I have a love for people, right? And if I do something, I'm going to do it not just for me, but I'm going to do it for people as well. So at the end of the day, let's be good to ourselves. When I'm good to myself and take care of myself, I will be better for my family, and I'll be better for the community in which I live. So to move forward, let's think renewal,
Yeah.
renewal of mind.
You're not alone. You're part of the enrichment center. You're part of that family. People
Yeah.
who are watching this podcast, you're part of the enrichment center family. I think it's finding those connections, making those connections where they're important. Sorry, I interrupted you there.
Oh, no. That's right on. That's right on point. I mean, we offer, what we offer is the opportunity for people to come together and to share what their knowledge, their skill, and their love for people. At the end of the day, that's what it is, And someone said to me, this week I was talking to Debbie Drusdick, and yeah, I'm putting her name out there. The former director.
Shout out to Debbie.
Yeah, she's the one who's been driving this bus for years, and right after I took over, COVID hit, but the bus is still rolling. You know what I mean? We just have a little less passengers on the bus right now.
Right.
But that doesn't mean that the bus is going to end. So what we want to do is to continue to offer the information that is relevant. And that's why I have you guys on, because you guys are relevant. What you have to share is relevant for our members. And as long as we're able to come together, look out for each other, I believe that we're going to get through this. And that's the key.
Yeah,
Absolutely. So I appreciate you guys coming, just coming on at the I think I called you all at the last minute, just the beginning of this week or something like that. But you guys are just awesome. I am so grateful that I have the opportunity to work with you guys, as a community, and you guys are doing an awesome job. Keep it up. Keep it up.
Right back at you.
Keep it up.
Same to you, Del.
Yep.
Thank
Right
you.
back at you.
Let me see if I can do it. Yeah. Yeah. So as we get ready to get out of here, those of you that's watching right now, you guys have any last word for those who are watching before I say anything?
Nope, you did a nice job of summing it up.
Thank you so much for having us again. It's always fun.
Yes, and we're going to do this again, a little down the line. Let's see what happens, between now and January, and we'll pick it up again and give an update with regards to where we are.
Great.
All right. Yep. Thanks, guys. All right. Thank you for watching.
Thank you.
Those of you that's watching, we appreciate you. We love you. Please take a moment, love yourself, love your significant other, your husband, your wife, your children, your family, and more than all, love your neighbor as you love yourself. Take care. Have a wonderful I was about to say Thanksgiving.
Ah.
Have a Merry Christmas. I'm probably
Mm.
thinking about that cake again.
Getting hangry.
Yeah.
Have a Merry Christmas and a Happy New Year, and we'll see you soon.
Okay.
Merry Christmas, friends.
Bye-bye. See you, Dell.
Okay.
All right.